Hi guys, so we're going to go on to the second half of chapter 14, which is developmental disruptive behavioral disorders. So these are particularly for children who are having a hard time controlling their behavior in life. So the classic one that we all know about is attention deficit hyperactivity disorder. It's actually not ADD anymore, it's ADHD. But there are other behavioral disorders out there that you often don't hear about unless you're in the field of psychology. But as a parent or a teacher or a psychologist or a nurse or anybody, you may, or standing in the line at the grocery store, you may experience these other behavioral disorders. So what we're going to talk about in this presentation is we're going to talk about what behavioral disorders there are, or at least the diagnoses that we have. You always have to remember that not everything has a label yet, and a lot of things psychologists like to argue about, so not everything is totally agreed on. But we're going to say what the behavioral disorders are, what the symptoms of them are, identify the comorbidities, or the things that can often go with the behavioral disorder. So for instance, you may have a kid with ADHD, but they may have a stress disorder or an anxiety disorder. OCD often goes with it. There's all sorts of disorders that can be comorbid with it or that commonly go right along with it. And then we're going to talk about the biopsychosocial approach to treating these disorders. So how do we treat them? What medicines do we give? What therapy treatments do we give? All right, so we know about ADD, or more commonly now called, or more properly called, attention deficit hyperactivity disorder, ADHD. But there's also two other, I guess you could say infamous ones, oppositional defiant disorder, ODD, and then conduct disorder. And these are basically a badly behaved kid, a bratty kid, but it's more serious than that. I mean, and not that brat is really a diagnosis, but you know, when you think of a brat, you're often thinking of a child that is somewhere on the continuum between just typical mischievous childish behavior up to serious, like, I will kill you type of behavior. So let's talk about ADHD first. So this is the most common neurobehavioral disorders, particularly among children. It can also happen with adults. Oftentimes, though, the childhood ADHD will get better over time as the person ages. Sometimes adults still have ADHD. It's a smaller percentage. And then you can also have adult onset ADHD, where you were fine as a child, but as an adult, suddenly you have a hard time focusing. And that's usually, the adult one is usually associated with traumatic brain injury. So for instance, I knew someone who was in a car crash, they were T-boned, and after that, for years, they just had a hard time concentrating, couldn't really read books, and they were a research scientist, so they stopped publishing papers, and you know, there's just all sorts of focus issues. The prevalence, 6 to 8% of youth worldwide, 4% of adults have this. Now, worldwide is sort of misleading. I'm getting Instagram notifications, sorry. Worldwide is misleading because some countries have way better ADHD rates than other countries. America is one of the ones that are not doing so well. France has a fantastic rate, a fantastically low rate of ADHD. So their kids rarely have a hard time focusing, which sort of is evidence for an environmental factor. I mean, you could say the French people have different genetics than Americans, but Americans are such a hodgepodge of so many cultures that that's not really a good argument. So it's most likely an environmental thing. So as you can see, adults have a much lower rate or prevalence of ADHD. And then ADHD impairs or causes distress in multiple domains. So it's not just I have a hard time focusing, but now I have a hard time socializing with other kids. I don't get along. I'm more likely to be bullied. My teacher doesn't like me. I do worse in school. My grades suffer. I have poor self-esteem. I get in with a bad group. We commit crimes together. I get into drugs. So it has a ripple effect throughout all the other domains of life. ADHD is often comorbid with learning disabilities and psychiatric illnesses. So dyslexia, various mathematical disorders. So, I mean, there's all sorts of, we'll learn, I don't want to get too much into the learning disabilities right now because we're going to do that in another chapter, but ADHD will often go along with that. And one of the reasons is because they're both can be symptoms of an organic brain illness. So, for instance, my sister had meningitis when she was a baby, viral meningitis. She's lucky she didn't die. And because of that, she had severe ADHD, severe dyslexia, severe learning disorders, and she was still able to, she actually has 2 master's degrees now, so which is amazing considering how much difficulty she had to overcome. She's very smart, but the virus just damaged the brain. I mean, it wasn't severe. You would never think that there had been any issue with her, but it caused, the brain is sensitive to damage, particularly in areas of learning and focus. So ADHD will often go along with those. And then other psychiatric illnesses, you know, if you have a child with schizophrenia, which is rare but does happen, child with bipolar, then focus is not really a strong point with those psychiatric illnesses, and so you will often have them diagnosed as ADHD as well. So various treatments: educational, psychotherapeutic, psychopharmacological, try saying that 5 times fast. So there are different ways of treating these disorders with drugs, with education, like teaching your child how to focus. My sister never took any ADHD medication. I just worked with her a lot to get her to focus, to get her through her assignments, and she was able to succeed. So educational is great. Psychotherapeutic is often the best, not just for the person with ADHD, but for their family, because a lot of people who have children with ADHD get frustrated, and child abuse can easily arise from that. Child abuse often happens not because the parent's an evil person, but because they're a really frustrated person with no coping mechanisms, no ways to deal with this really difficult situation. And that's a perfect recipe for child abuse to happen. So psychotherapy can be very helpful for this. Now, ADHD has been shown to be genetic. So you can see in this chart, the yellow bars are the correlation coefficient for genetics and ADHD, meaning that the two are associated. So if you have certain genetics, you have a likelihood of having an ADHD on a correlation of, if you look at this, so I can draw on here. Okay, so, you know, the lowest score is somewhere around here, okay, so 0.6. Height has a correlation coefficient of almost 1, which means a perfect correlation. You have certain genes for height, you will have that height. And and this has really been done on twin studies. So if your identical twin is 6 feet tall, the chances of you being 6 feet tall is really high. So for height, I mean, 0.9 correlation is super high. 1 means every time one goes up, the other one goes up. Every time you have a twin with X thing, you will have it. That would be exactly 1. 0 would be, this person has it, no association. You coincidentally might have it, but there's no relationship. 0.4 is a moderate, 0.6 is pretty decent, 0.8 is a really strong correlation. So you can see with breast cancer, you have a little bit above a 0.2 correlation, so it's somewhat genetic, but not highly genetic. Asthma is a bit more genetic, it's moderately genetic. Schizophrenia is pretty darn genetic. If you have a twin with schizophrenia, there's a very high likelihood that you will have it. And then the average correlation, and these are all different studies, so of the average of these studies for ADHD, it's 0.8. So it's highly genetic. If it runs in the family, there's a good chance that you or your children will end up with ADHD. So what are some of the features? Hyperactivity, meaning lots of energy, inattention, impulsivity. Lots of energy, inability to control yourself, inability to focus, Really, when we talk about a brat, not that that's a psychological diagnosis, but this is really sort of what we're talking about. The kid that can't stop, they just go, 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 they never calm down, they're always just wired. Now, those are the core features, but that does not necessarily mean a child has ADHD. Okay, that's not all it takes to be diagnosed with ADHD. Number one, you have to have an onset before 7 years old. Okay, ADHD, if it starts at 10 or 15, we don't consider that ADHD. So some of the videos that you guys turned in were with adults with ADHD, and you could not accurately diagnose them with ADHD unless the onset was before 7 years old. So that's one of the questions that you should ask if you're diagnosing. It must also be present in more than one setting. So it can't just be at school, the kid is insane. It won't focus, won't listen to the teacher, won't settle down, stands up when they're not supposed to. If that is the only setting, for instance, my sister's kids went to a school in Apple Valley for a little while, and they were not cutting it. Like, they were not doing good. And of course, the kids get blamed, but our reaction was, they're perfectly fine in every situation. At home, at church, when I'm babysitting them, when they're with their mom, when they're with their grandma, they're fine. There's no issues. So if they're only having issues in school, that does not qualify for them for an ADHD diagnosis. And one of the things that I always look at is, are there times when your kids can concentrate? Because in my opinion, that ixnays the ADHD diagnosis. If your kid has the ability to focus at all, then it is an environmental influence. It's not ADHD. So it must be present in more than one setting and must also cause functional impairment. So if you are raising your children in a, what's it called? Not free range. I can't remember. There's a philosophy of parenting where you basically just let your kids do anything, and there's no rules. And your kid is hyperactive, inattentive, and impulsive, and you're perfectly fine with it, then we wouldn't diagnose them with anything. They're functioning perfectly well. And this is something that helps to control for culture, because certain cultures really don't put a lot of emphasis on children being able to buckle down and focus. If you are white, Anglo-Saxon, Protestant American, then yeah, your kid is going to be expected to buckle down and focus. If you are, I lived on the Navajo reservation for a year, for instance, and I lived with a pastor, so I'd go to church with his family, and during the church service, while he's up there preaching, the kids of all of the Native Americans would just be running around like crazy, playing tag, literally playing tag in the middle of church, and nobody blinked an eye. And I'm sitting there, you know, I'm half Native American Indian, which is why I was there, but my mom's Irish, so I definitely have the white Anglo-Saxon Protestant attitude towards parenting kids, and I'm like, nobody's, like, if that was my kid, I'd kill them. I'd absolutely murder them, because I can't believe, like, no, you're totally breaking every parenting rule that I have. But for them, it's fine. It does not bother them. So I would not, if I was working with a Navajo child, and, you know, their white teacher or black teacher, whoever said, this kid has ADHD, I would say, no, the kid's just Navajo. And not saying like, oh, it's just built into their genetics. It's built into the culture. It's not that focus and that sitting still and listening and everything is not as, it's not required as much with younger kids. I mean, as they get older, they start buckling down on that, like, follow the rules, pay attention, focus thing. But with little kids, they just really expect them to be kids, and you know, they don't have those expectations. Anyhow, I think you get the point. So it doesn't cause impairment. All right, so there are subtypes of ADHD. Predominantly inattentive, predominantly hyperactive, impulsive, and then a combined type. Most kids are the combined type, so they have some inattention and some hyperactivity. 20 to 30% are predominantly inattentive, so they're easily distracted, but they're not excessively hyperactive or impulsive, so they don't have that energy, that inability to follow the rules. They're good kids, they follow the rules, but I just had a thought there. I'm calling them good kids because they're following the rules, right? There's a cultural bias for you right there. Just because a kid isn't following the rules does not necessarily mean they're a bad kid. They just need to be taught, right? Anyhow, whatever. I'm being a therapist right now. So they're able to follow the rules, but they're just not paying attention. That's predominantly inattentive. Then on the other side, they're fine focusing. They're just so energetic. And that's predominantly hyperactive, impulsive. Now, the younger the child, the more likely they are to be this. And then combined, you have all three of these signs. And that's most people, most kids. So my cell phone distracts me as much as it distracts you guys probably. So what am I being right now? Predominantly inattentive. Do I have ADHD? No. I can focus well most of the time. I mean, I think there's times for everybody when they're inattentive, particularly if something's boring. I remember being in classes where my thing was if I could draw during class, then I could pay attention better. But that was the boring classes. When there was a class that excited me, I had zero problem paying attention. So that is also one of the things that you have to look at as a therapist. Why is this child not paying attention? Why do they have so much energy? Is it really them, or is it an environmental trigger? Is it because they don't like their teacher's treating them bad, another kid in the class is bullying them, their parents are divorcing, right? That causes anxiety in all of us. And how is a child supposed to express anxiety? They usually do it by ADHD symptoms. So you really have to look at what is the cause of this. Is ADHD is supposed to be something that is organically wrong within the person. It's like an individual diagnosis. If it's caused by relationship issues, then it's not truly ADHD. It may have the same symptoms, but it's not the same thing. It's a relationship issue. It's not ADHD. Okay, so it is a clinical diagnosis, and then what I'm saying is it's made by history and collateral. So when did this start? When did it become a problem? If it was before age 7, maybe we say it's ADHD. But what is their family history? What's going on around them? Are the parents going through the divorce? Was there domestic violence? Is there drug use in the home? How much TV does the child watch? How many rules are there? Because if it's being caused by one of those things, it's not truly ADHD, and that's what people don't understand. ADHD is not truly a diagnosis with an environmental cause. It's something within the person. If you're really accurately diagnosing ADHD. Psychometric tools. This means testing. They're supportive. They help. You can sort of figure out, but they're not diagnostic. In other words, there is no test for ADHD. And they're diagnosing everybody's child practically. If the kid disrupts the class, if they're not perfectly behaved, they have ADHD. It's ridiculous. There is no test for it. There's very limited diagnostic criteria for it. I mean, we have what's in the DSM, but there's so many issues that could cause those exact same symptoms in a child. And like I said, if it's being caused by a relationship issue or lack of discipline, it's not truly ADHD. So then you have to also establish impairment. Where is the distress in this? If everybody's getting along fine and nobody cares, then you can't diagnose ADHD. And then comorbidities. What else is going on in this situation? If they have ADHD, they probably have other stuff. And then rule out medical conditions. So here we go again. If the child has hyperthyroidism, where their thyroid gland is producing too much energy and they're just hyperactive, they don't have ADHD. They have hyperthyroidism. If they have, oh gosh, I don't know what else would cause high energy. Let's say the kid could be diagnosed with, maybe they just broke their arm, okay, and they are in pain and they're having a hard time focusing. That doesn't mean they have ADHD. They're in pain. Okay, so do you see the difference there? Something caused by medical condition, inattention, hyperactivity, impulsivity caused by medical condition, by family issues, and so on, is not ADHD, no matter what the kid's teacher says. All right, so in school children, we often see easily distracted, poorly organized homework, careless errors, often incomplete or lost, low academic scores, frequent trips to the principal's office, blurts out answers before a question is completed, interrupts and intrudes on others, low self-esteem, aggression, doesn't have friends, doesn't wait for their turns in games, often out of seat, seems to be immature, unwilling or unable to do chores at home, accident-prone. This is the criteria. Do you see how it's so broad, it's so global? There's a million things that could cause this in children. So I could look at your child and say, yes, they have all these things. They have ADHD. Here's this very powerful I can't speak today. This medicine for your brain, which I obviously need to be taking right now. See, lack of focus, and I definitely don't have ADHD, but I stayed up until 4:30 in the morning last night, and then got up again at 6. So there's something else. If your child is tired, they're going to look like they have ADHD, even though they absolutely don't. They're tired. That's not the same thing as ADHD. So these things could be caused because you didn't discipline your child. You didn't teach them how to do their homework. They are not enjoying school. They're bored out of their mind. There's a million things that could cause ADHD symptoms in a child. It does not necessarily mean that they have ADHD. In teenagers, it's a little bit different. They seem to have a sense of inner restlessness rather than being hyperactive. They procrastinate, poor follow-through, not organized, can't work independently, like they need somebody to be on them all the time. They feel bad about themselves, don't have friends. Inability to delay gratification. Now let me just stop right there, because the inability to delay gratification is a huge thing. It's one of the best predictors of success in life that the child or teenager or adult can delay gratification. I'm going to put another video up that shows the marshmallow experiment, which is a great experiment for delayed gratification. And what it is they said to little kids, you can have one marshmallow now, or you can wait till I come back and you can have a second marshmallow. And they looked to see, did the kids just eat the marshmallow, or were they willing to wait a few minutes for the second one? The ones that waited were much more likely to have success in life. It strongly predicted success. Specific learning disabilities. That's probably the best cue for ADHD. There's actually, they have dyslexia or a math disorder or something like that. That's probably the most highly correlated. That and delayed gratification are good correlations for ADHD. Behavior is not modified by reward or punishment. So if you are effectively disciplining a child and then they still can't focus, now we've got some good evidence that this person has ADHD. Engages in risky behavior like speeding, unprotected sex, substance abuse, disregard for their own safety, difficulties or clashes with authority. Now again, these are symptoms of ADHD, but couldn't they also be, your dad abandoned you and your mom is a crack addict and is hardly ever home, and you're basically raising yourself in the slums of San Bernardino, and you're doing the best you can with life, but you joined a gang in order to have a family, and now your life is just all sorts of screwed up. Is that ADHD? I don't think so. There's many psychologists who would agree with me that that's just your life has gone in a bad direction. That doesn't really mean that you have ADHD. But if you have ADHD, then that could push you in a direction where these things happen. So just because you speed, or you join a gang, or you get arrested, or you have disregard for your own safety, does not mean you have ADHD. It's simply a red flag for ADHD, if that makes sense. Hopefully it does. All right, domains of function. So these are the areas there could be difficulties with. So if you were assessing a child for ADHD, you might want to ask them or their parents about what is their before school routine. Do they have a hard time waking up? Do they get themselves up? When they get ready for school, what is it like? Are there fights in the morning? In school, how are their grades? How's their focus? How's their friendships? After school, sports clubs, homeworks, risky behavior. Do you eat together? That's one of the best predictors. I know I've said this before, but there's a lot of not a lot, but there's a few really good predictors of success in life. And sitting down to a family dinner together is a huge one. And then what's the bedtime routine? So these are all things that you could ask about and assess to determine if the kid really has ADHD or not. All right, and then comorbidities. So you have ADHD, okay, ADHD, and it is connected to other diagnoses, ODD and CD, or oppositional defiant disorder and conduct disorder, which we're going to talk about next. There's some kids with ADHD who also have this, but notice there's a lot of kids who have those diagnoses that don't have ADHD, okay? So just because they have a behavioral disorder like these does not mean that they have ADHD, but they could have both. You could also have kids with bipolar disorder, which is rare, but happens. And bipolar disorder, I mean, that's going to be it's going to involve behavioral disorders like oppositional defiant, learning disorders, depression, and anxiety. Kids with depression and anxiety could have ADHD or maybe not. Kids with learning disorders can be all throughout these. Tic disorder, we'll talk about that later. Tic disorders, they blurt out cuss words or they have certain movements or things like that. We'll talk about it more though. So you see how these are the ones that commonly go along with ADHD, but does not necessarily mean that you have both of them. And you could have more than two, so it's complicated. So if you are a psychologist assessing for ADHD, you also need to look to see if, let's say you've diagnosed them, for sure this kid has ADHD. Well then, do they have bipolar? Do they have oppositional defiant? Do they have a learning disorder? You have to look for all of these. You may not look for schizophrenia, for instance, but you definitely need to look for bipolar or, I said borderline personality before, didn't I? I didn't mean that. Bipolar disorder, tic, learning disorders, depression, etc. All right. Also, let's see, I think I talked about all this. So the other one that goes with this is also substance abuse. Drug use is often associated with ADHD. Now, this is a chicken or the egg thing. Which one came first? Did the drugs cause ADHD, or did taking the drugs, or did having, what did I say before? Did having ADHD cause drug use, or did taking drugs cause ADHD? It could go either way. Okay. Oppositional defiant disorder. So oppositional defiant is basically a kid that is just difficult, really, like seriously difficult. Not just like, oh, my kid is hard to raise and I have problems and we get into fights occasionally. I mean, this is a really difficult child to work with. So a pattern, meaning it happens consistently, of negativistic, defiant, disobedient, and hostile behaviors has to be happening for at least 6 months. Okay, it can't just be it happened a few times. It has to be consistently over 6 months. And then 4 out of the 8 often loses temper, often argues with adults, often actively defies rules or refuses to comply, often deliberately annoys other people, often blames others for mistakes, touchy or easily annoyed by others, angry and resentful, spiteful and vindictive. Okay, so this is a child who is just misbehaving to an extreme. Okay, this is not just a misbehaving child. This is an extreme, like it's causing distress and dysfunction, and it is difficult for the parents, and it's difficult for the child, and it's pretty severe. Okay, and see, all of these start with often. It is happening often. So, like I said, it's severe. It's causing significant impairment in social, academic, or occupational functioning, meaning job. And that could be for a child or adult. So if your 5-year-old has ODD, then obviously their job isn't impacted, but yours might be. It doesn't occur exclusively during psychotic or mood disorders. So sometimes a child could have a psychotic or mood disorder where they have an episode with these behaviors happening. If it is simply a result of an issue with depression or schizophrenia or something like that, we wouldn't say the kid has oppositional defiant disorder. So again, these things sort of bleed over into other diagnoses. And then we'll talk about conduct disorder later, but if it meets the criteria if the kid meets the criteria for conduct disorder, then they no longer have oppositional defiant. They're moved up or down, depending on how you look at it, to conduct disorder. Conduct disorder is extreme. So this is a pattern of violating the rights of others and or major social norms. In the past 12 months, in at least 3 of the following: aggression to people and animals, destruction of property, deceitfulness or theft, and serious violation of the rules. So this is a child, often you'll see like in elementary school, the kid is just difficult, constantly getting into trouble, constantly getting into fights, bullying other kids, stealing little things here and there. And then if the kid doesn't get help, then when they hit teenage years, now it's full-blown conduct disorder. And this is the kid that's getting arrested, taking drugs, beating up other people. Like when I was in elementary school, my sisters and I went trick-or-treating for the first time on our own because it was the 80s, so parents let their kids do stuff like that. And we got jumped. Candy got stolen. But, I mean, like my little sister was 10 years old, and they didn't just go, like, run up and grab the candy and run off. But they literally, and these were, I don't know if they were just older teenagers or actual young adults, but, like, I remember they grabbed my 10-year-old sister by her hair, held her, one of them held her hair, and the other one was just socking her in the face. I mean, that's serious, like beyond, like, sometimes kids candy snatch and do stupid stuff like that, but to beat the crap out of a child in order to get their candy, I mean, that's conduct disorder level stuff. Hurting animals, killing animals, hurting and killing animals is the first red flag that we look for a sociopath. Somebody like Jeffrey Dahmer, who murdered and ate people, who's a serial murderer. He started with injuring animals. So conduct disorder is a serious thing. Now, we'll talk about personality disorders later on, but conduct disorder, so it starts with oppositional defiant, goes up to conduct disorder, and then will often continue into antisocial. Now, obviously, the amount of people in each of these disorders is going down. So antisocial personality disorder is rare. Conduct disorder is a bit less rare. Oppositional defiant is significantly less rare than conduct disorder. So each one is as you age, it's more and more rare to get into these serious disorders. But, I mean, obviously it happens. So those are the three major behavioral disorders: ADHD, oppositional defiant, and conduct disorder. Now, some of the comorbid things like learning disabilities we're going to talk more about in the future, but these need to be identified. They need to be tested. If somebody has ADHD, I don't do the testing myself, but I will absolutely refer them to somebody who tests for learning disabilities, like automatically. I don't even need to look for any evidence of it. I would automatically give them a referral. Other things, Tourette's syndrome, which is like the tic disorder, sleep disorders, because again, remember, fatigue can cause inability to focus. It can also cause hyperactivity. So think about when you are so tired, like maybe when you're driving and you can't keep yourself awake. What do? You're like bounce, like, oh, okay, keep myself awake, and you become hyperactive in order to counterbalance that fatigue. So a child may actually be hyperactive because they're so tired. Anxiety disorders, hearing problems could actually cause this. So I have a hard time hearing things. I'm not going to focus well. Or, I can't hear what the teacher's saying, and so they tell me to do something, and it looks like I'm being disobedient. And then there's other developmental disorders that could be causing issues. There's side effects from meds. Anyhow. So there's all sorts of things that could cause problems.